My name is Tamuiza Betty Irene. I work with Women with Albinism Association as the Human Rights and Advocacy Officer. We are here in Greater Iganga shooting the documentary under the project of Human Rights Advocacy for Women and Girls with Albinism.
Amaina gange ninze nayigaga Sala ngamba na Mutumba district ekyalo kya Bubutia. Nze nganze kino ekibiina kyenfuniemu obuteetya n'atambula n'akubera abantu ekituufu twatolaga endowooza enfu kati endowooza enfu nga ife weelusabe olweru abairugavu batubona n'omuntu abaire ali eri mukayu aja yamweta yamukati dosooka obone oba oluso olweru ali kupita mpega nti batweta ati balusulweru baja bayogerera ekigambo nti namagoye wula alikola ki ali kupita ati bana mwide mubone namagoye wuna alikola ki ali kupita ate ekigambo ekyo kituvoola ino twafunamu okwetya ayi kati bwe twayingira mu kibiina kino nekitulogote eyo nekituleeta eno tufuuka ab'ekibiina twavaamu okwetya era kati saawa dino ntambula nakubera ekituufu nti ife twena tuli bantu mpegano we tutuukeyo mwidwaliro kangeze nga nze gyenvuira Bubutia tujja mu health center eya gundi eyebulange mpegano we tutuukeyo nga nze abankoba n'okunkoba tusooka olinde iwe omusawo anaakukola kuki aliyo nga bali kutya olwekale gyendi nayo batuboola batusosolera irala
batusosola
owuunye kunkyo datukesaawo munaana okaali eyo kuki.
My name is Mpia Stephen. I'm a Community Development Officer in charge of Disability and Elderly, Uganda District Local Government. Women with albinism and girls in the district, they are there, though they are scanty. I'm in this office, but very few of them approach this office. They tend not to disclose their challenges. So very few of them approach this office. When we have meetings, very few attend meetings. Yeah, as a district, I want to first of all request that the mobilization and sensitization should be conducted so that these people are aware that their services are the health center. Then I would also recommend that the leaders under Women with Albinism Association need to be trained in lobbying and advocacy.
So services that we are mulimu family planning, mulimu kugemesa, mulimu abaida continental, kubidana byobwabuliddo, okukola opinion interventions, twaba ni art services abali kumpeke, twaba ni nemusigale lwanga bifuna. Ayi last moment nenaze nfuna nti olwaire banayiba nibakozi bananga abandi bajja babatyamu muwodi yetukwera abakyala tunamu ebitaana bibiri mwene omwambula amukyala mwina alimu balina engeri akola ki ebafuna obuzibu so baba nga beetya boona ate kayini balibona bakola ki abatya.
Neze Kataba Muhammad, Division Chairperson of Iganga Northern Division, ekyagana wa Iganga Municipality mu Greater Iganga District. Nenda okutangaza nti bwe nali ne budget conference nagezaako okukirengeza abantu ate kyanamba nti turn-up yali nungi era n'okobera abantu nti twetanira banamagoye tubende ng'abantu ab'obulindo kuba banaife ekyokuba nti babulako olususu ti koba nti bulwaire buli awo bw'amaanyi ino tutababoola limu nteekateeka nga nikwenda ogemagana ne ali in charge health tubenga abantu abo mu budget yaife tubatamu.
Gabula Ezra
the district chairperson for Iganga district. I'm also a person of disability, or with disability. I want to thank especially IDIWA and an organization in charge, Albinism, for really the wonderful work they have done for us in form of advocacy, whereby these people with albinism, there was a serious belief that, maybe these people are cursed, and when they die, they go in heaven. And even other people were, looking for heirs from their heads for ritual making, so that the people can become rich. So I want to implore people of albinism so that they pursue the work diligently, so that other people can see you are being industrious with the work. So I want you to create change so that the people can say, we admire such a person to work with, by being friendly, by being jovial, by being creative, if not innovative.
I'm Mrs. Kagwa Hajira, working with an association called Women with Albinism Association as a program coordinator. Women with Albinism Association is abbreviated as WA. WA was established in 2016 after realizing that women with albinism face heightened discrimination, intimidation, marginalization, and sacrifice. Then they formed a uniform voice, of which they had wanted to improve their standards of living through advocacy, so that they can demand human rights and to improve their livelihoods. This organization was funded by a donor from DRF, that is Disability Rights Fund, to implement on the human rights advocacy for women with albinism in the greater Iganga, because Iganga had the biggest coverage area, not until it was divided. But due to the scarcity of people with albinism being scattered, so we decided to implement this activity in the greater Iganga. This activity has managed to empower us through the advocacy, and most of the achievements that we achieved are as follows. 1, since it is a project of 1 year, we managed to implement it fully as planned and budgeted. That is an achievement. Remember, I've told you earlier that we are recently established, so being a young organization on the growth, you can misuse the funds, but here we have managed to implement as planned. Then we have managed to train and sensitize the duty bearers through meetings, workshops, and we have managed to empower them through being that they are going to get prepared to advocate for our rights. Secondly, they are ready to give some support through the meetings. They were able to give us commitments. These commitments are being followed up. So when we follow them up, some are being fulfilled, and we are benefiting through these duty bearers. We have managed to empower the board, the staff, and the beneficiaries of WA through the trainings, several trainings, under their roles and responsibility, and in their dockets, their capacity is empowered. They are able to run the project smoothly, each one in their dockets. Then we have some challenges The challenges that we faced, they are minor apart from the COVID-19. It tackled our project so much, we were not able to start on time, but after which we started the implementation and we had already completed it. It was a big challenge because you remember that there was a lockdown. We couldn't move from our homes to come and implement the project. Another challenge is during the implementation, we have the duty bearers being invited. As you know, they have a lot on their desks. They couldn't manage their time. This time management towards the duty bearers, it was not manageable. But what we did, we can adjust some 1.5 hour so that we complete the session. Then another challenge was of delegation. These officials had the tendency of delegating. Like I can say, we are inviting a CDO, then that CDO invites an assistant CDO to the training. But what we have done, we have seen that we follow up on the commitments that were made during the meeting, and then after following them up, we always update them of what is taking place. As a program coordinator, I appeal to the government to include persons with albinism so that they can participate fully in the community initiatives, because women with albinism can and want to be involved in these initiatives, but they are always left behind. So we want them to be included in the government programs. Then also, to the side of the health worker, we want to see that they can involve us in their services other than neglecting us. They always give us neglection, being that they have a myth, they fear to touch on us. Let them give us full services after knowing that we are all human beings apart from not having that melanin color. I remain Kagwa Hajira, appreciating the donor, DRF, and the physical sponsor, IDWA, plus the WAR team for the teamwork and the good collaboration that have managed us to fulfill all what is planned. Thank you.